what I'm currently doing to further lower my cholesterol. So I thought would be a great way to do a presentation is to show all the diet and exercise and lifestyle and supplements out there that I recommend to the patients that I see, and what helps us to get the excellent outcomes that we do. I can tell you, like last year in our clinic, we did over 2,500 patient visits. Of those visits, 82% of them have heart disease, but we had less than 1% of those visits with a heart event. So there is a lot that we can do to prevent heart disease, prevent an event through just diet, lifestyle, supplements, and managing our risk factors, including our cholesterol. Also, at the end of the presentation, Cardiotabs has been very generous. They'll give you a promotion code, I believe, at the end of the presentation for a reduction in fees off of some of their products. If you stay for the end, you can get the promotion code. I believe that will happen. But I'd like to first start off by saying it is a whole new world. People are finding out if they have heart disease much earlier than waiting until they have a heart catheterization, where they come in with crushing chest pain and they have to go to the cath lab to have an artery open. That is kind of the old way of seeing it. It's actually a medical failure if someone comes into the cath lab not knowing that they have heart disease at this point in time. Many people are finding out that they have heart disease through a CT scan of the heart. Here in Kansas City, St. Luke's Mid-America Heart Institute offers them for $50. So many people will pay more for their cell phone bill each month than they will for a one-time CT scan of the heart to find out if they have hard plaque. There's nothing invasive with the CT scan, but what happens is they're finding out they have hard plaque. They're finding out earlier that they have this plaque in their heart, and they're asking, what can I do to prevent this from growing any further? What can I do to prevent this from turning into a heart event? And one of the things that we tell them is to get their risks under control. A lot of patients will think that plaque slowly grows until it blocks blood flow to the heart, and that's kind of the old way of thinking. We actually know today that plaque works a lot like a zit. Before a zit erupts, it's red, inflamed, and festers, and then there's a thin layer of skin over it. And then eventually it will erupt, and that's exactly what happens with plaque. Once you have plaque in the heart and the artery, if we don't get risk factors under control, whether it's blood pressure, cholesterol, blood sugar, stress, inflammation, smoking, if we don't get these risk factors under control, the plaque will be red, inflamed, and agitated. If we don't build a thick cap over it, it's easy for it to burst. And when it bursts, it's sudden death or sudden heart attack, depending upon how much blood flow it blocks to the rest of the body. So it is important that we get our risk factors under control and that we stabilize our risk factors. The next two I thought were interesting slides. I've got them from the American College of Cardiology. These are cadaver arteries with plaque in them. So you can see the artery wall. You can see the thin cap that was once attached to the artery wall, and that the plaque burst through. And here's another picture. If we could have walled it off here where the cap was, it wouldn't have been such a big deal. And you can see there's several linings in the artery wall here. One of these linings is filled with smooth muscle cells. These smooth muscle cells will migrate around and form a nice thick cap of the plaque, and it does that when we do aerobic exercise. And then what eats away at that cap are risk factors that aren't controlled. So it truly is getting risk factors controlled and exercising. And I love to show this slide because a lot of people, you know, when they've had a heart stent placed or an angioplasty done where they took a balloon in and opened up the artery wall, they believe that they're quote, cured. But the truth is, or the fact is that when you have about a 160-pound male, he has about 1,000 meters squared of vasculature from head to toe. And we put a stent in that male. We're only treating 1/5,000,000th of the vasculature. When you treat your risk factors and you get your diet and exercise pristine and you treat your risk factors, you're actually treating 100% of your vasculature. And that's what we want to do. We want to make sure that you have a healthy vasculature. So with that, we'll start with the cholesterol management tip number 1. And that is we really need to get our waist circumference under control. We are actually blowing the top off of high waistlines here in America. In fact, I thought this was very fitting since this is the Olympic year. USA is leading the obesity event compared to any other countries in the world. So we do need to get our waist circumference under control. We need to be more knowledgeable as to what that means for our health. In fact, one time we used to think that fat cells were just storage depots. They did nothing but store fat. But we know today that not all fat cells are created equal. In fact, the fat that's around our waist, which is also around our organs, is highly active. And so it's not a storage depot. It actually works against us. In fact, these are all of the chemicals and hormones that the fat cells will secrete around our waist. Over here, it's angiotensinogen. It raises blood pressure. The free fatty acids that it increases all adds to diabetes. These are clotting mechanisms, adds to clotting. Again, this is inflammation, leads to asthma and arthritis. These in this next slide are organs that the fat cells, having a high waist circumference or abdominal fat or having belly fat, these are the organs that affects. It affects the lungs through asthma and sleep apnea. It affects the liver through a non-alcoholic fatty liver disease. In fact, they're saying, experts are, statisticians are stating that by 2015, the #1 cause for a liver transplant will be a non-alcoholic fatty liver. Basically, our liver metabolizes carbs and sugars, and when we eat too many carbs and sugars, then it can't keep up, and so then the carbs and sugars adhere to the liver. But inflammation, liver enzymes go up a little bit, and when that inflammation turns to scar, we don't get that part of the liver back, and we end up with cirrhosis of the liver. But it's a non-alcoholic cirrhosis of the liver. So the fat cells in our waist circumference and eating too many carbs and sugars can hurt our liver, can also cause gallbladder disease, can cause abnormal menses, infertility, polycystic ovarian disease, can lead to some cancers, can also cause pancreatitis, high blood pressure, high cholesterol, diabetes, heart disease, stroke, and cataracts. So what we once thought were just storage depots, this abdominal fat or that belly fat is actually working against us to hurt our organs. A lot of places will still measure body mass index, and even in our clinic we measure a body mass index, but we don't do that alone. We add with that a waist circumference, because the waist circumference, the taller you are or the shorter you are, the less accurate a body mass index is. But a waist circumference is one of the best predictors of who's going to have the next event. So we want your waist circumference to be half your height in inches. So if you are 70 inches tall, we'd want your waist circumference to be 35 inches or less. Next question I often get is how do we measure waist circumference? And it's interesting because I always hear the technician talking, because the technician in our clinic will measure the waist circumference, and you always hear the patient say, well, I can't be a 44-inch waist when I wear size 38 pants. And that's because we don't measure underneath the belly. We measure actually what goes to the door first. So when you want to measure your waist circumference, it's the top of the hip bone, what goes to the door first to the top of the hip bone. And if you don't know where your hip bone is, if you've been to your right side and your left side, you can feel your hip bone. But that's what you want to measure, and you want your waist circumference to be half your height in inches. This next slide is just two bodies that are 100-pound difference, and the yellow is the fat. So you can see where the fat stores, and when it's around the middle here, you can see all the yellow around the organs. And again, this is a 100-pound difference in body fat. So it really is important that we maintain an ideal waist circumference to optimize our health. It's interesting because a lot of patients that have family history of heart disease or afraid of heart disease, and even people that I talk to when I'm giving presentations, they stay away from red meats and saturated fats, but then they go all to carbs and sugars because they think that that's what they should eat and that's what's going to get them away from heart disease. So many people are just confused on what should I eat, what should my plate look like. And what we tell our patients is that when you look at your plate, you should have lean protein and at least 2 colors, which are fruits and vegetables, not from M&Ms, but fruits and vegetables. Each of your meals, that should happen at each of your meals and for snacks. So a lot of times patients will ask me, well, what are lean proteins? Well, healthy nuts such as walnuts, almonds, and pecans are lean proteins, turkey, chicken, fish, even red meats in the form of red meats that end in loins and rounds are usually leaner cuts of meats. Can you have red meats? Sure. Get the leaner types of meats and try to have it just once or twice a week. Egg whites is a healthy source of protein, all natural peanut butter, whey protein, half cup of non-fat cottage cheese is another source of a healthy protein. And we want to make sure that we avoid pastries and sugary foods. So when I'm telling patients to get rid of the belly fat, it is eating healthy, exercising, and then I also recommend Cardio Tea. Cardio Tea is an all-natural supplement, and it's rich in flavonoids. It has catechins that help to naturally speed up your metabolism. And when we help to naturally speed up the metabolism, then it helps to reduce the belly fat. It also has theanine, and that's the calming effect in tea is when you have theanine. And so it has some theanine for calming effects. The caffeine in it is what's like in a decaffeinated cup of tea, and it's a mix of a green and black tea supplement. So, I'm sorry, it's a mix of green and black teas in the supplement. So it's highly effective when I'm looking at helping people get rid of belly fat, and I tell them to do Cardio Tea, diet, and exercise. Always make sure that you rate your plate. When you look at your plate, we want to see colors on your plate. So I always tell patients if you look down at your plate and you don't have color on your plate, then you probably need to redo your meal and think about adding some colors. And again, it needs to be from fruits and vegetables because the more antioxidants on your plate, the healthier you'll be. The next two, I just brought a couple of case studies. This is what I ask patients, all new patients that come to the clinic, I ask them what their breakfast, lunch, and dinner was the day before. And it's interesting to see. So I thought I would share with you some of these case studies. In this particular case for breakfast, they had a vanilla latte from Starbucks and a cookie. So there's no protein or color. This is a convenience and pleasure breakfast. It's nothing that none of this is nutrients that would feed their organs. Lunch, they had salad with whole grain bread and a diet soda. Whole grain breads will break down to sugar. In fact, some of the wheat breads out there will break down faster to sugar than a Snickers bar. Salad is great, especially if they load it with color, like bell peppers and onions and tomatoes and cucumbers. And then at 3 p.m. they had a snack with M&Ms and another Diet Coke. And dinner they had spaghetti with meat sauce, 2 pieces of bread, and 2 glasses of wine. So the only protein that I see for the whole day was in the meat sauce, and the rest of this was loaded with carbs and sugars other than the salad. So again, we need to have breakfast, or we need to have protein for breakfast, lunch, and dinner, and we need to have lean proteins. At breakfast, lunch, and dinner, we need to have fruits and vegetables as well, breakfast, lunch, and dinner, and as for snacks. So you can tell this person is addicted to sugar. They eat that 3 times a day and for their snacks. This next case study was Cheerios with sliced strawberries and orange juice. Cheerios, I know the box says it's heart healthy, but it's loaded with carbs and sugars. There's no protein in it, and it will raise your triglycerides, and it will raise your blood sugar level. So we don't recommend Cheerios for breakfast. Again, we recommend lean proteins and fruits and vegetables. The sliced strawberries are excellent. And orange juice, we always tell people to go for the fruit versus just the juice. If somebody gave you and I 8 ounces of apple juice, it would take us maybe 2 or 3 big gulps to swallow that 8 ounces of apple juice, and we would say, boy, that tasted good, and we would be just as hungry, correct? Well, it took 3 apples to make that 8 ounces of apple juice. You and I would not be able to sit here and have 3 apples right in a row without feeling full. So you're better off to go for the fruit where you get the bulk and the fiber, other vitamins and minerals, as well as the natural sugar and antioxidants. This person for lunch had salad wrapped in a wheat tortilla and sweetened tea. Again, that's more sugar. They had animal crackers and banana at 4 p.m., more sugar. And dinner, they had a double cheeseburger, french fries, and a Diet Coke. So they had more sugar or carbohydrates because that breaks down the sugar with the fries and the bun on the hamburger. And then they had a small bowl of vanilla ice cream before they went to bed, more sugar. Again, we need to look at lean protein, breakfast, lunch, and dinner, and fruits and vegetables to eat your meals and for your snacks. So cholesterol management tip number 1 is to get your waist circumference, get our waist circumference under control. And cholesterol management tip number 2 is to know your numbers. It's interesting, I had one of the physicians approach me, I've had several physicians actually approach me and say, I always know what patients see you because they know their numbers. They know what they mean and they know where they're at. And that's probably one of the most important things you can do because there's a range of where your numbers are fine at. Are you on the high end of that range where you're nearing to be at a risk? Or you're in the low end of that range where maybe you can fudge a little bit every now and then or healthier because you're on the lower end of that range. So we'll start out with HDL, your good cholesterol. The higher the better with HDL cholesterol. For men, we like it above 45 and women above 55. Again, HDL is heart protective. The more of this, the better it is for you. LDL is your bad cholesterol. It's low density lipoprotein, so lower we want less of it. If you have heart disease, diabetes, carotid artery disease, peripheral vascular disease, aneurysm, we'd want it less than 70. If you have 2 or more risks for heart disease, we want it less than 100. So if you have heart disease or heart disease equivalent, your LDL, your bad cholesterol, should be less than 70. And if you have 2 or more risk factors for heart disease, your LDL should be under 100. And so I hope you guys have your cholesterols in front of you and you're looking at where you're at and where you are in the range. Everybody's triglycerides, we want to see them less than 150. And all triglycerides are carbs and sugars the last 3 or 4 days before the test. So the main things I want you to know is where your HDL, LDL, and triglycerides should be. HDL for men above 45, women above 55. LDL, bad cholesterol, if you have heart disease or heart disease equivalent, less than 70. Or if you have 2 or more risk factors for heart disease, less than 100. And triglycerides for everybody should be less than 150. There is a ratio for how the total cholesterol is calculated, and it's calculated by adding the good cholesterol, the HDL, plus the bad cholesterol, the LDL, plus triglycerides, but they're divided by 5 before they're thrown into the equation. So the total cholesterol doesn't tell us a lot. We want to make sure the HDL, LDL, and triglycerides are at goal. In fact, I have on your screen here that the total cholesterol of 200 here is the same in both of these individual cholesterol panels. But this is a woman who has 2 or more risk factors for heart disease. So since she's a woman, we want her HDL above 55, and her HDL is 80 in this first scenario. So her HDL is good. She has 2 or more risk factors for heart disease. We want her LDL less than 100, and her LDL is 95, which is excellent. Her triglycerides that we want less than 150 is 125. So this person's total cholesterol 200 looks excellent. The next line is a woman that has 2 or more risk factors for heart disease as well, and her total cholesterol is 200 also. However, her HDL is 35, so that's under 55. We want it to be above 55, so this HDL puts her at risk. Her LDL we want less than 100 as she has 2 or more risk factors for heart disease, and so her LDL is 127, and that gives her a risk. Her triglycerides we want below 150, and they're 190. So even though they have the same total cholesterol, you can see the second scenario here, the second line of cholesterol, is at more risk than the first scenario here. It's interesting, this is the same woman. This first line was her pre-menopause, and the second line was a few years later post-menopause. But this also happens in people that, in the first scenario, they're exercising, eating healthy. In the next scenario, they actually gained 15 or 20 pounds. They quit exercising, and they're eating bad things and more carbs and sugars. And so you see the change in the cholesterol. When we still look at hunter-gatherer humans that that still live the hunter-gatherer lifestyle in America, Their total cholesterol is excellent, 110, 100, 120. And then when we look at some wild primates that live off the land, their total cholesterol, again, this is total cholesterol, not LDL cholesterol, but their total cholesterol is 110, 140. And then when we look at some mammals that I consider to have some weight issues, such as the pig and the elephant and the rhino, they all have a total cholesterol of 100, 110, and 90. And the average American comes in with a total cholesterol of approximately 210. So again, we need to eat lean protein, fruits, and vegetables. We need to eat foods off the land. We need to know our numbers, and we need to get our waist circumference under control. So cholesterol management tip number 1 is to get waist circumference under control. Cholesterol management tip number 2 is to know your numbers. Cholesterol management tip number 3 is to lower your LDL by changing your diet, exercising, and supplements. And we're going to talk about each one of these. LDL is your bad cholesterol, and you know, because you know your numbers, that you want it to be either under 100 if you have 2 or more risk factors for heart disease, or under 70 if you have heart disease or heart disease equivalent such as diabetes. And what we want to do now is to change our diet. And in order to lower LDL cholesterol, we need to decrease saturated fats and trans fats in our diet. So just think about how many saturated fats you've had in your diet today or yesterday. And these are from cheeses, creams, ice creams, marble cuts of meats, ground beef, bacon, sausages, poultry. And then the next are trans fats. In fact, this is a quote I got from the Forever Young Diet and Lifestyle book that Dr. James O'Keefe and registered dietitian Joan O'Keefe have put together. And a quote from them is that some of the worst foods on the planet, they include baked goods such as cookies, crackers, donuts, pastries, croissants. And I often will tell my patients that the healthiest thing about the donut is the center. So we do need to make sure that we cut out saturated fats and trans fats in our diet if we actually want to lower our LDL cholesterol and have good, healthy arteries. In fact, when we eat these things, not only does it increase our bad cholesterol, our LDL, but it lowers our good cholesterol. It increases our triglycerides. It damages the artery wall, and it leads to plaque buildup. So we do need to change our diet. The other thing that I recommend for LDL lowering is not only decreasing saturated fats and trans fats in our diet, but there's 3 over-the-counter supplements that I recommend. The first 2 you can take with your prescription statin medicine. It's perfectly fine. I already talked to you about the Cardio-T. I will recommend Cardio-T not only for getting rid of belly fat, but it also is powerful in antioxidants, and it will work to lower LDL anywhere from about 10 to 15%. So it's a good over-the-counter supplement for getting rid of belly fat and lowering LDL cholesterol. Another supplement that I recommend that you can also take with your prescription medicine is that if you're taking a statin, I'll go back to the Cardio-T. I guess I didn't say this early. There's some studies, on the Cardio-T that showed it reduced atherosclerosis in animal models, that lowered LDL cholesterol, and it prevents LDL oxidation. And for those of you that don't know what LDL oxidation is, when your LDL becomes oxidized or your bad cholesterol becomes oxidized, it then clings to the artery wall, and we start to have plaques to form. That's why it's important to have antioxidants in the form of fruits and vegetables, so you have multiple antioxidants in your system. Having Cardio-T is powerful in antioxidants. It helps to decrease the oxidation that goes on in the system. It reduces the oxidative damage to our DNA. It improves endothelial function, and in some epidemiological studies, it showed that it reduced cardiovascular events. So Cardio-T is one of the supplements I go to for LDL reduction. Another supplement I use are cardiosterols, and they're plant sterols. And they can reduce LDL anywhere from 10 to 15%. What we want to make sure that we do on the cardiosterols is you want to get about 2 grams per day of the cardiosterols, and this actually prevents the absorption of cholesterol. So it's recommended by the National Institutes of Health Therapeutic Lifestyle Changes for Cholesterol Health to have about 2 grams a day. The FDA believes that diets low in saturated fat and cholesterol that include at least 1.3 grams of the phytosterols, which is what is in cardiosterols, can reduce the risk of heart disease. It's recommended you take this 15 minutes before a meal or even with a meal at least, and I tell people to take 2 capsules with 2 of their biggest meals a day to help lower their LDL cholesterol. And again, you can take the sterols as well as the Cardio-T with a statin medicine if you're on a statin medication. If you're not on a statin medication, you can take them just by themselves. The third supplement that I use for lowering LDL cholesterol, and by the way, not in this order do I use these, it just depends on the individual. But the third supplement that I use is red yeast rice. And red yeast rice is very interesting. It's basically the natural form of a statin medicine. It's over the counter, it's all natural. Statins were actually derived from this red yeast rice. And what red yeast rice is just, it was a fungus that was found on rice and in China, and the people that ate the rice with the fungus on it had less cholesterol. So a scientist comes into town and puts a lot of the fungus in a capsule, and out comes your first statin medicine. So what I like about red yeast rice is that it's all natural, and it's got monocolin K in it. That's what statins have in it, but this has a low dose of monocolin K. In fact, the whole capsule itself, only 4% of the red yeast rice capsule in the Cardiotabs products has the form of a statin, lovastatin in it. So it's only 4%. But there's other monocolins from red yeast rice that actually work to lower LDL cholesterol that's in the product. So that's why it works so well. There is a dark side to red yeast rice. Most of the products are produced in China, and so many do not meet the FDA standards for safety and purity, and sometimes the red yeast rice can have, and a lot of them that happen to come from China, they can contain a chemical called citrulline in it, which is toxic to the kidneys. So you want to make sure you get a pure red yeast rice, and I would try to look for those that are in the United States. I personally quit recommending red yeast rice several years ago, because about a decade ago, because oftentimes I would put people on it and it would be laced with a pharmaceutical strength statin in it. And so liver enzymes would be up, they would not feel well on it, and then the next time they got the same type of bottle, it would hardly have any of the statin strength in it, and I could never regulate cholesterol. But the Cardiotabs red yeast rice, Dr. O'Keefe and Joan O'Keefe worked for several months to have it made here in America and have it regulated. It doesn't have citrulline in it, and so I've been using red yeast rice frequently with my patients. In fact, I did a study with red yeast rice and liquid fish oil, and in the study we had excellent reduction in LDL and triglycerides, and I'll show you that study here at the end. Cholesterol management tip number 4 is we need to raise HDL through smoking cessation, exercise, obtaining an ideal weight, so losing weight if you need to, and supplements. And that's how we raise HDL cholesterol. We picked HDL to be higher, for HDL to be above 45 for men and 55 for women due to this Framingham offspring study. Where you see the 1 mark, that's the neutral mark. So the neutral mark means it doesn't cause you any adverse events, nor does it give you any benefit. It's just neutral. And so when an HDL for men is at 45, it's neutral. So 45 or higher is where we recommend men. And for women, when the HDL for women is at 55, that's where it's neutral for them. So 55 or higher would be beneficial for women. If you do smoke, you need to quit smoking. That's the most powerful preventive lifestyle anybody can do, is to stop smoking. Stopping smoking will raise HDL cholesterol. I always encourage people to set a quit date, because if you don't set a quit date, it won't happen. Even if you have to set 2 or 3 quit dates or 7 quit dates, by setting a quit date, eventually you will get there. There's over-the-counter products that you can use to help stop smoking. And then there is pharmaceutical products or prescription products that you can use to help stop smoking. I encourage you to visit with your healthcare provider in regards to that. But stopping smoking will raise your HDL. And the other thing that raises HDL is exercise. And Exercising, we do recommend 45 minutes most days of the week, but if you're not doing any exercise right now, I strongly encourage you to get 10 minutes in of walking every day and making it a priority. Just start with 10 minutes, and you'll start to see even at 10 minutes of walking for the purpose of exercise will start to raise your HDL cholesterol. So the more you do and or the more intensity of your exercise will raise your HDL cholesterol. If you're overweight, recommend that you lose weight. That will raise your HDL cholesterol, but don't be discouraged. Typically, when you make a drastic lifestyle change and you lose weight, first the HDL will go down before it increases, but it will increase. And the other over-the-counter supplement that I use for HDL raising, or the supplement I use for HDL raising, is nicotinic acid or niacin. You can get niacin over the counter. You just need to be careful on that and what kinds you get. You want immediate release niacin, and I would discuss this with your healthcare professional as well before you begin to take it, because it can cause a flushing sensation. You may feel red or feel like a prickly sunburn. When you take niacin, all it is vitamin D3, but it will raise your HDL cholesterol, and there's at least 25 to 30 choices of niacin products out there, and you want to make sure you get the immediate release niacin, or even there's a brand called Enduracin that I have recommended that's had some small studies with it, but it will also raise your HDL cholesterol. Higher doses will help to lower your LDL cholesterol as well, and niacin also lowers your triglycerides, and that is an over-the-counter supplement. Triglycerides. Cholesterol management tip number 5. We recommend lowering triglycerides through exercise, diet, and supplements alone. Triglycerides, all that is, which I stated earlier, is just simple carbs and sugars that you've consumed 3 or 4 days before your blood test. So if you have your cholesterol profile in front of you, if your triglycerides are high, above 150, the 3 to 4 days before you had your blood test, you've had an increased amount of carbohydrates and sugars. And so I show patients what their blood looks like with high carbs and sugars. In fact, the slide here is the blood tubes of the patient, and you can see here's the blood from here to here, and the triglycerides settled on the top. This is the tube down here on the middle one, but the blood starts here and it goes all the way to here, and you can see all the carbs and sugars that they consumed here. This actually was hardened, and by the end of our visit, and when I turned this upside down, you could just hear the funk as it moved inside the tube. So this person is craving lots of antioxidants, lots of fruits and vegetables, and less carbs and sugars. So to lower triglycerides, we tell patients to limit or cut out simple carbs and sugars on a daily basis, which is what I talked to you about earlier. What we should have to eat is lean proteins and fruits and vegetables. Exercise to lower your triglycerides, 30 to 45 minutes of exercise most days of the week. If you're not exercising at all, even 10 minutes of exercising for the purpose of exercise is beneficial. And we recommend omega-3 fish oils for lowering triglycerides. But when you take omega-3 fish oils for lowering triglycerides, you actually need a higher dose. You need anywhere from 2,000 to 4,000 milligrams or 2 to 4 grams of the DHA and EPA daily. So I want you, when you look at your fish oil bottle, I don't want you to just look at what's on the front part that says how many milligrams. I really need you to turn it around. I need you to look at the DHA and EPA, because those are the two healthy omega-3s that you want to have in your body. And so you want to look at how much DHA and EPA you're actually getting. And you want them, if you have high triglycerides, to be anywhere from 2,000 to 4,000 milligrams or 2 to 4 grams. And as I just mentioned, I also recommend niacin, anywhere from 500 to 2,000 milligrams to lower triglycerides as well. Exercise will also lower triglycerides. Again, if you're not exercising, even if you do 10 minutes a day of cardio exercise, you're going to see a difference in your HDL cholesterol. Exercise not only helps get rid of belly fat, not only does it lower triglycerides, it raises your good cholesterol, it lowers your blood pressure, your blood sugars, your heart rate, and it decreases your clotting risk. So I strongly encourage everybody to exercise every day. And this is what the American Heart Association recommends for fish oils. And I was just going to point out the very last statement here: patients needing triglyceride lowering. And this is where the American Heart Association is also recommending 2,000 to 4,000 milligrams or 2 to 4 grams of the EPA and DHA to help lower your triglycerides. So the Cardiotabs have 3 types of fish oils, and I often get this question as well: is, Becky, which fish oil should I take and why is there so many? Why is there 3 different choices, and why do you choose what you choose for different people? So I have them lined up together on one slide for everybody can see. The original omega-3, the first picture here, it's actually a smaller capsule and it's enteric-coated. And so people that can't take the bigger fish oils, I typically recommend the smaller capsules. And in 3 capsules, you can see what the DHA and EPA is in those 3 capsules. So you're getting about 975 milligrams of the DHA and EPA. The middle omega-3 fish oil is the extra strength omega-3 fish oil, and it has vitamin D3 in it as well. When you take 2 capsules, you're getting 1,200 milligrams of the EPA plus DHA combined, plus 600 IUs of vitamin D3 in 2 of those capsules. It's a little bit of a bigger capsule. If you can tolerate taking a bigger capsule, then I recommend the extra strength. That's the one I recommend most often. If you needed to lower your triglycerides, however, you would have to take 4 of the middle extra strength omega-3 capsules. And the one on the far right is the liquid fish oil. This liquid fish oil is the most potent of the fish oils that's out there. You get about 2,100, 2,200 of the EPA and DHA and 1,000 international units of vitamin D3 in just 1 teaspoon. So in people that don't want to take 4 to 6 capsules to lower their triglycerides, it's just 1 teaspoon of liquid fish oil. What I like about the liquid fish oil is children can take that. So when they're about 1 or 2 years of age, you can start doing like half a teaspoon of this every other day for your children. And then when they get to about 5 or 6, they can take about 1 teaspoon a day. So it's healthy, and people that have a hard time swallowing pills, I recommend the liquid fish oil. So this was the result of the study I was telling you about earlier. We did an open-label study of people where they took red yeast rice, 2 capsules twice daily, and they took a teaspoon of liquid fish oil. And what we found is that the LDL was reduced by 28%, triglycerides reduced by 22%, and the good cholesterol was raised by 15%. So we had excellent outcomes with the over-the-counter supplements. I will say on the red yeast rice, it's recommended anywhere from 2 to 4 capsules daily. So if you want to start out with just 2 capsules and see how you're doing and get your cholesterol checked, that's great. And then you can up it to 4 capsules if you would like. So just to end, the cholesterol management tips that I recommend is for all of us to get our waist circumference under control, for all of us to know our numbers, to lower LDL through changing diet, exercise, and using supplements, to raise our HDL through smoking cessation, exercise, weight loss, and supplements, and to lower triglycerides through exercise, diet, and supplements. And I've kind of highlighted diet, weight loss, exercise, because diet and exercise and weight loss and getting our waist circumference where it should be are very important for all of our numbers. In addition, that we have over-the-counter supplements. Thanks, everybody, for attending today, and I'll take some questions.
Sure. Great job, Becky. Everything you said was very insightful. And for all those sticking around wanting to know the promotion code, it is code OPTIMIZE. So just enter OPTIMIZE at checkout, and you can save 15% on your order. And now, Becky, if you don't mind, we can take some questions that people have left.
So is it possible that despite a vegan diet, supplements, and exercise that I can still have high cholesterol? And that is true. Our liver produces cholesterol, and for many people, it overproduces cholesterol. Also, being on a vegan diet does not mean that you're actually being healthy. Many vegans will have more carbs and sugars, and the triglycerides will be up, and the sugar levels will be up. So you just want to make sure that even if it's a vegan diet, that you're having protein and fruits and vegetables on a daily basis. And if you do all those things, and exercising and taking supplements, and you still have high cholesterol, you could just be, liver could be overproducing cholesterol, which there is familial hypercholesterolemia, which is high production of cholesterol by the liver, and when we have that, we probably need prescription medications, and I would recommend you see a healthcare provider for that. The next question I have are, what are the difference in the effects of cardiosterol and red yeast rice on lowering LDL cholesterol? The site says not to take both. You can take both the red yeast rice and the cardiosterol. I tell my patients that they're able to take both of them together. And the cardiosterol works to prevent the absorption of cholesterol when you consume it. That's why it's important to take the cardiosterol with food. And the red yeast rice works to tell your liver not to make so much cholesterol. So they have a little bit different. They work a little bit differently, and you can take both those together. What you don't want to do is you don't want to take the red yeast rice with a statin medicine. Next question is, what's the best process for phasing off of a statin? Well, I definitely wouldn't stop a prescription medication without talking to your healthcare professional and to see, you know, if what you're doing is in replace of that is going to be effective enough. But you can just stop a statin medication, and you don't have to taper off of it or anything. You can just stop a statin medication if you're on it. But again, before you do that, I would consult your healthcare professional just to make sure that that's really what you want to do and that that is the best option for you at that time. Is there any way to reverse plaque if cholesterol is in check? You know, we have learned that we can. So we've learned that we can regress plaque minimally, but stabilize it greatly. And so what we want to do is, if you have plaque, we want to stabilize your current plaque. We want to do everything we can to prevent it from bursting. That's why I showed the plaque bursting at the beginning. So we need to make sure that we get risk factors under control to keep that plaque stable. We really haven't found great ways to reverse plaque. There's been studies that show some small reversals, but to basically eliminate the plaque and get rid of it, we have not gotten there scientifically yet at this point in time. So the best thing to do is to get all your risk factors under control and keep it stable so it doesn't grow. So the question is what number am I looking for when I add HDL, LDL, and triglycerides divided by 5? So really somebody's asking me what number am I looking for total cholesterol. I have less than 190, or sometimes I'll say less than 200. But to be honest, that number doesn't tell us anything. As I showed you, we had 2 cases where the total cholesterol was 200. One was healthy and one was not. So I really do not go by total cholesterol. I think on the handouts that I give to patients where I work, it says less than 190. That's just because, you know, everybody asks if I don't have a target there, what should it be? But in reality, we just want the HDL, LDL, and triglycerides at target. And if those are at target, it doesn't matter what the total adds up to be. I can take one more question. See. What is the current thinking about a cardiac dose of either B12 or niacin for managing cholesterol? So cardiac dose, I'm assuming, I don't know if that's right, but we recommend anywhere from 500 milligrams to 2,000 milligrams of over-the-counter immediate release niacin. So B12 is not niacin. B3 is niacin. So immediate release niacin is excellent for raising HDL, lowering triglycerides, and the higher dosages like 1,500 milligrams and 2,000 will lower LDL cholesterol. I think there's a lot of good things with niacin. I would consult your healthcare professional, and I would make sure that when you got your over-the-counter niacin, you would get a product like Enduracin or immediate release niacin, and avoid the ones that say flesh-free niacin, because the flesh-free niacin do not alter your cholesterol at all, and it's actually hard on the liver. So we want to make sure that if you take over-the-counter niacin, you get an immediate-release product or an Enduracin, and consult with your healthcare professional, because there are side effects when you take the higher dosages where you have the flushing sensation. So definitely talk to your healthcare provider before taking. And then that kind of answered another question about non-flushing niacin. Can it be used with Cardiotabs fish oil? You can take fish oil and niacin together, but you do not want to take non-flushing niacin. It will not change your cholesterol level. and it can be dangerous actually to your liver. So we do tell people not to take the non-flushing niacin. Thanks everybody for your time.
Thank you, Becky. Had a lot of great information there. A recording of the webinar will be sent out to everyone who registered, so you'll get a feel of the slides and be able to, we'll put it up on YouTube and I'll email it out to everyone. And we hope to see you at Nature's Pantry this Saturday, where you can meet Dick Wilson and get an answer. All your health questions can be answered by cardiologist Dr. James O'Keefe, and any more questions for Becky or his wife, Joan O'Keefe, who's a registered dietitian. So we hope to see you out there, and thank you very much for attending the webinar.